Okay, so let's start our session. And I can see there are about 30 participants. Okay, that's a good number of participants. Okay, so this session is not about anything. It's not an educational. I'm not here to teach you anything. It's more of like I am here to answer your queries because the admin and everybody of our platform has told me that there are lots of questions of you guys, lots of questions of students, and lots of queries of you students. So I asked them to please arrange a webinar where I will directly interact with you guys and just answer your queries, whatever you have to ask. So I will just dive into it. I will try not to stretch this session very long. I will keep it to the point. I will keep it precise. So anybody who has the question, it's if possible, you guys just type your name and I will ask you. You unmute yourself and ask me the question. Or if you have any question, if you're not comfortable speaking, just type in. So I would be directly interacting with you guys. Okay, Dr. Ali, you can unmute yourself and please ask me whatever you want to ask.
Assalamu alaikum, sir. I'm new to OET and I've got no idea regarding how to take OET, what it's all about. And initially we used to have IELTS, so now it's OET. So you please guide me how exam is conducted? What's the format of the exam? Thank you, sir.
Okay, no problem. Okay, Dr. Ali, so the thing is OET and IELTS are two different exams. It's not interchangeable. So these are two different exams. You can either take IELTS or either you can take OET. What is the difference between IELTS and OET? IELTS is basically it's generic exam. IELTS have two parts. It's academic and it's journal. So anybody who wants to study, who wants to work in a healthcare setting has to go through the IELTS academic part. Here comes the OET. OET is specifically for healthcare professionals. When I say healthcare professionals, it includes nurses, it includes doctor, it includes dentist, it includes physiotherapist, and everybody who is associated with healthcare professions. So, if you're a healthcare professional and if your aim is to work in a country where English is the prime language, for example, Australia, Singapore, UK, US, you have to take OET. Okay, so that is why OET is designed for that, for those candidates. So OET is conducted mostly twice a month, and as for any language, it has four subparts: listening, speaking, reading, and writing. And you are judged on these four parts, but you are judged in a healthcare setting. For example, you will be given a letter. For example, you will be asked to write a discharge letter, referral letter. So they will assess your writing in a healthcare context, they will not give you a diagram like they give you in IELTS or some kind of statics numbers and will ask you to write in as your give your opinion on that. No, OET is judged on in a healthcare professional setting. The same goes for other modules. For example, in listening, you will be listening to a context between two doctors. It can be either a conversation between a doctor and a patient. So whatever there is, it is in the context of healthcare setting. So it's easier for you to understanding. It's easier for you to grab that knowledge and then attempt the question. So that is in summary, this is what OET is about. And as I told you, the purpose is you want to make sure, you want to prove that you're proficient in English language, you're proficient when it comes to talking with the colleagues, talking with doctors, and you have enough grip on this language and you can work comfortably. So that is all about. And when it comes to scoring, most of the countries, they actually, there is grade B, which is like 350, more than 350 marks. So most of the countries, the minimum is 350. Whatever you take more than that is good for you, but the minimum is 350. If your minimum score is 350 in each module, then you're good to go. Okay. I hope this answers your questions, Dr. Ali. And there is Zoom user how to write the purpose in the first and last paragraph in the writing.
Sir,
Yes, please speak.
Sir, I want to say that the purpose of this meeting should be the tricks and tips for passing exam, which may be more fruitful than only discuss the roadmap and modules and sets. I think we should discuss morely on the topic tips and tricks of the reading, writing, speaking, and listening.
So, what's your name? Can you tell me your name, please?
Sir, Dr. Khawar Ali.
Okay, Dr. Khawa, thank you for your suggestion. Dr. Khawa, unfortunately, we had a session before this. We had a very long session around around it. It was like 2 or 3 hours long session. We had it before where I discussed actually how you can ace the exam, and in that webinar, we actually practiced a reading scenario as well. But no problem. I will tell you one thing, Dr. Faber. There is one thing. There are two things which you need to know to join to actually ace this exam. One, you need to understand what is the structure of this exam. You need to totally understand it. You need to get yourself familiar very well with the structure and what they are going to assess from you in this exam. And it's not for this OET exam. It's for every exam, any exam in your life which you're going to take. First of all, you need to make sure that you're familiar with the pattern, you are familiar with the structure, you are familiar with the marking criteria and everything. If you're not familiar with an exam, unfortunately, you are going to struggle at that exam. It goes with for any exam you take in the world, you have to make sure that you are very familiar with with the structure. Okay, so first thing to is my first tip is to get yourself familiar with the structure. And what do I mean by that? For example, you need to know what is the listening. Okay, you need to know there are four subparts, and then again when you know there are four subparts, then you again to know what is included in those four subparts. For example, in listening there are three scenarios, there are three, I would say, parts that you'll be going to assessed on. Same goes for reading. In reading you are going to be assessed on three, and then again in speaking you'll be given two scenarios, and in writing you'll be given one letter, but there are different kind of letters and you can be given either one of them. Okay, so first of all, the first most important trick is that you need to get yourself very familiar with this. And if you're not familiar, okay, this is, I have told you a summary. And again, if you're taking an exam, you need to a little bit, you need to do a little bit of research for yourself as well. Okay, because when you get your research done and you're familiar, then you have some questions, and then this is where I come in. If you have any questions, if you have any queries, if you have any problem, you are familiar with the structure, but you are not understanding how do I pass this, for example, reading part, and how do I attempt this reading part. This is where I'm coming in, and I'm trying my best to help you. And another trick is, you do not need to, for example, I have seen people, I have met a lot of people who are going to cram, different words and different vocabularies, includes the grammar. No, you have to stick what you know. The other tip is, keep yourself very simple. Keep yourself, for example, in speaking, you stick to the card questions. You do not beat around the bush. You stick to the card questions. You try to ask those five questions in 5 minutes, 5 or 6 questions, whatever the sets of question is there. You make sure that you ask those questions in those 5 minutes. And same goes for reading. You need to make sure that you're not running out of the time. You need to make sure that you are attempting all the questions, all the parts in the time. So second thing is, keep it very simple, and also practice a lot and make sure that you are attempting all the things in the given time. So these are the main two tips and tricks. Other than that, what exactly do we need to do is, what is this course about? For example, I cannot tell you in this 10 minutes or 15 minutes how you can ace the reading part, how you can ace the listening part. For that, you need to subscribe to the course, and this is where I'm going to help you. It's a 16 session long course, and again, in those 16 sessions, I'm going to try to help you, try to tell you what exactly do you need in every part to ace the exam. Okay, I hope this answers your question, Dr. Khawa. Okay, Dr. Yes, please.
Thank you, sir.
Thank you, Dr. Khawa. Dr. Tayyib Asmat, I'm beginner and you want to know how to start preparation for OET. Is it necessary to join any academy or any source, video lectures, any material for preparation? Dr. Tayyab, again, it depends on you. Okay, this is a very subjective thing. For example, I know, for example, myself, when I was preparing a couple of years back for OET, I did not take any academy, I did not take any kind of video lectures. As I told you, first of all, what I did, I made myself very, very aware of the exam, that what is this exam about? What are they going to ask you? What is the criteria? What is the structure? Once I was familiar, then I started practicing. So there is no actually need to join any academy, any source, any material. You can find a lot of source online. Okay. Yes, one thing that people struggle with is, for example, you are practicing on your own, but there is no feedback. So this course, or why am I here? I'm here to help you, to try to tell you this, where you are lagging, or what are the things that you need to work on. So that's what is this all about. And there is Aliza, can you explain the difference between OET writing subtests for nurses and doctors? Aiza, sorry. So Aiza, there is not much difference in the writing subtests for nurses and doctors. Honestly, you will be given one scenario, one part, or some patient information, and then from that from those comprehensive notes, you need to make a referral letter, a discharge letter, whatever that is. So there is not actually much of the difference in writing of the nurses and doctors. You will actually find them very similar. There is not much difference on it. And however, Ellie says, sir, I am weak in listening. Kindly guide how to improve. Okay, so however, what one suggestion I would try to tell you is, see, so whatever if you're weak in listening, what exactly are you struggling with? Are you struggling to understand the conversation? Are you struggling with keeping that information in your mind? Are you struggling with the time? Are you struggling with listening and writing the answers simultaneously? What exactly is there that you are struggling with? Can you please type that down for me, and then I will tell you. There is Shah Muhammad Baba, and he is asking guide in writing basics. So, Shah Muhammad Baba, the writing in writing, as I told earlier, that you have to keep yourself very simple. So there are lots of information. For example, if there is a writing for, let's say, discharge, and there is information given for the patient for, like say, there is given 3 years back history, past history of him. So you do not need to write all of that notes in the discharge. What you have to do is, first of all, you need to make sure in the first paragraph, you need to make sure what this letter is about. You have told that this is a discharge letter, and then comprehensively, very briefly, that this patient was presented on this date and was suffering from this. And then in the second paragraph, what I try to suggest is you write the relevant information. When was this patient admitted? Was what was the treatment plan, and what was given to him? And in the third, you mentioned some relevant past history. For example, if there is a patient who is suffering from MI, it is very unnecessary that you are mentioning his cataract information, his ENT problem. So write the relevant past, and then in the fourth, just try to thank and tell them that I am referring this patient. So keep it very simple. Again, it's 180 to 200 words. So, you have to keep yourself very, very limited, and you have to make sure that you're writing the relevant information. Okay, guys, I am trying to answer all of your questions. Just bear with me. I am trying to read all of this, and there are lots of sub messages. Dr. Tabinda Munir, which subtest is more difficult, writing or reading? Dr. Tabinda, it again depend on you. Some people may find reading very hard. Some people may find listening. Some people may find speaking. So it's a very subjective question. It actually it varies from person to person. There is no one rule which I can say that reading is difficult or writing is difficult. It depends on you. If you are finding reading difficult, okay. Some people may find listening difficult. So there is no actually there is no hard and fast rule that this one subtest in OET is the most difficult. Kindly guide how to start the preparation of OET for doctors. So Askana was again, as I said, that first of all, you need to make sure that you need to make yourself very aware of this exam, the structure, the format, the marking criteria, everything. And then if you are opting for this course, we will have 16 sessions, 4 sessions for each subpart, and then we will try to make you prepare in those 16 sessions, and that will be for 1 month. Can you pass without preparation if your English is good? I don't know what your name is. The name is iPhone M. Again, iPhone M. It depends on your luck. If your English is good, again, this English depends on you. If your English is good in the context of healthcare, okay, good for you. You can pass the exam. But again, I think for any exam which is a competitive exam, you do need preparation. So I think you do need preparation. Accent are different. Khawar Ali is saying accent are different in different aspects. Yeah, okay, Khawar, I totally understand that there are problems with accent, and some people have very hard time to understand those accents. So what I will suggest you in these kinds of scenario is, for example, if you're listening to a subtext, try to listen it 2 to 3 times more. If you're struggling with listening, try to listen it more and more, so you get yourself familiar with that one accent. And then again, when you hop onto the next listening test, you again listen to that one more than 1 to 2 times. So that exactly is how you overcome your weaknesses. If you have weakness in one part, you try to listen to that again and again and get yourself familiar with that accent, with the pronunciation. And again, listening is all about practice. So is there any sample test where we can access also? Murtaza, there are lots of sample tests online. You can find you can find sample tests on the official website of OET. If you want to get yourself familiar, if you want to access those, you can access those sample tests. They are available on OET website. I feel difficulty in reading part, especially part one, Dr. Amjad. Okay, Dr. Amjad, I can understand a lot of people do have problem with reading part. And in the reading part one, can you exactly tell me what kind of difficulty do you find? Do you find to absorb the knowledge, or what kind of difficulty it is? Guidance for reading is Dr. Maliha Rasul. Dr. Maliha, see, the reading is, there are three subparts of the reading, sorry. So what I would suggest is, in reading, all you have to make sure, first of all, is you need to make sure that you are managing your time very well. Okay, and again, then it comes to how fast, how good reader you are, and how much of the knowledge can you absorb in your mind. So again, I would say it depends on you how well. Dr. Harun, can you please? Yes, thank you. So Dr. Tabinda is, sir, I have cleared once OET, now want to repeat again. Any advice? Dr. Tabinda, if you have passed once time, then what kind of advice do you need? If you are familiar with the exam, then I think you do not need my advice.
Sir, hello.
Yes,
Sir?
please.
Hi, sir. Hi, I'm Dr. Tabinda. Sir, the problem was that I got only 350 in all the subjects, in reading, in
Okay.
writing, and in speaking, and in listening only I got 380. So I'm much scared because I passed by borderline. So what
Okay.
to improve now? Now it's going to expire on 9 July, my OET.
Okay. So can you please tell me, is it 2 years back?
Yeah, sir. It's in 2022 July.
Okay, and you want to take it again, and what are you planning? When are you planning? After, in August or in the July
Sir,
month
first
only?
June. Sir, I have got one job, and at the just before the job they told me that repeat OET. Like I'm in very much pressure.
Oh, okay. So it's your job requirement. So if your OET is valid, then why are they not accepting your current OET?
Sir, they are saying that it's mandatory to have OET for 6 months from now.
Okay. Okay.
That's
I
why.
am guessing that you have got the job in Ireland, I guess.
No, sir. It's some scheme of UK, some RCOG scheme, scholarship scheme.
Okay. So
Yeah,
Dr.
yeah.
Devin, there is nothing to worry about. I understand if you passed on the borderline. So if is there any one subtest that you struggle with?
Sir, I struggle with reading a lot. I
Okay.
remember, and writing a lot.
Okay, so there are lots of candidates. Honestly, Dr. Tabinda, in the past couple of years, I have met a lot of candidates who struggle with the reading. And I don't know if you attended the last webinar or not. I actually took very long. I actually took an hour more than that just to make sure that everybody understands how to attempt reading part. Okay, so for you, I will give you the tip. If you struggle with reading and if you struggle with writing, first of all, I will come to the reading part C. The part A and part B of reading is comparatively easy. The people struggle with the part C of reading. So for that, what I always
Sir,
advise
I
is do
made,
not.
yeah, yeah. So, sorry, sir. Sorry for the interruption, sir. I made the strategy that I will make write the reading part A and B. I will completely, correct them. And
Yes.
I think
Okay.
this was my strategy for this. And for the
Okay.
writing, sir, I don't know what I did, but I, tried a lot. My purpose was only clear, and after that, I didn't know what I write. So, like, it was a luck that I passed the exam. So now exam is again coming. That's why I'm much upset.
See, Dr. Taminda, one thing that I will tell you is, see, I understand your worry and I understand the situation you are in. But honestly speaking, if I'll give you very honest advice, is that if you struggle and if you are scared that, the last time when you passed, it was on the borderline. So this time, I think you do need feedbacks. Feedback is very important. So for that, I would suggest you is, if you want to opt, if you want to opt for this course, it will be very useful for you because you do have the past experience, and when you will opt for this course, you do will have the personal feedback, and then you will know how to improve and what are the weak areas of yours where you have to put some more extra effort. And I understand if your exam is 1 month away, I can totally understand that pressure and I can totally understand that anxiety. So for you, I will say there are two suggestions of mine. First, if you want to opt for this course, please go for it. It will be very beneficial for you. And second, do practice a lot. Practice a lot, and um, the more you practice, the more you will get familiar with yourself, with your pattern, that where exactly you are lagging.
I'm
And
sorry, like how many readings per day and listening per day? Can you tell me, and how many letters?
it depends. That depends. For example, if you okay, let's say if you are going to attempt five reading, let's say three reading test in 1 day, and still your score is 350, then that means that there is something wrong with you. There is something wrong with your style or with the pattern that you are attempting. You may be stuck. This is what I call plateau. So to cross that plateau or to hit that plateau, you do need guidance. So it depends. For example, in my case, when I was preparing for my OET exam, I practiced like what I only practiced 5 to 6 reading sessions, and that's it. Other than that, I was good because I got to know what is the strategy and how to ace that reading part. And I got like what 404. No, I got yes, I got 410 in my reading part. There is gifted to hello sir, I'm from India. Can you tell me how to start the preparation for OET nurses and how to improve reading part B and C? Gifty, I hope I'm pronouncing your name well. So to start for the OET exam, again, you need to know what is this exam about. You need to get yourself familiar with the structure, with the pattern, and then if you want to, and how to improve reading part B and C. So part B is, there is one sample given, and you need to know what exactly, and there are some multiple choices given below. So for the reading part B, it's really, you need to be very aware and you need to be very, what I would say, what is the proper word? You need to be awake. You need to be awake and you need to understand that in this small paragraph, what are they exactly asking? And you need to rule out the wrong answers from the answers given below, and that's exactly how you can ace the part B. And for the part C, what I would suggest is do not read the whole essay. The good thing about the part C is the questions given at the end of any passage in the part C are always in chronological order. So first of all, go to the question and then search for the answer in the above given text. Do not read the text, it will consume your time. Zoom user, should we write the purpose in the same words in the first and last paragraph? It depends. Yes, you can. Honestly, you can. You do not have to use fancy words. You can actually do that. So can you please guide us how to start preparation for OET and minimum preparation time? Otherwise, again, see, these kind of questions are very hard to answer. I don't understand why people ask such kind of questions. It's a very subjective question. It's the same way asking that, how long will it take me to, cover 100-meter race in 15 seconds. It depends. Every human is different. Every human has different mental capacity. Every human has different, um, you all are doctors. Some of you guys may be working, some of you guys may not be working. So it depends. It totally depends. It's a very subjective thing to ask for these kinds of things. So minimum time, if as a journal, I would say it will, for example, you can book your exam 1 month before. So I would say yes, minimum time should be 1 month. And how to start preparation? Again, get yourself familiar with the structure of exam and then start practicing. It's as simple as that. Alicia is asking, does your accent matters for speaking? Like, do you have to fake that English accent, or you can go with your natural accent? Alicia, you can go with your natural accent. You do not have to fake, and you do not have to fancy your accent, honestly. As long as you are being very clear and, the listener can understand you, there is nothing wrong with your accent. I cannot understand listening part A accent and reading part A. I cannot finish it on time. Same for the part C. Amir, again, for listening, I would say, if you're struggling with the accent, try to hear that one test again and again, unless and until you're familiar with that accent. Okay, this is the only strategy. There is no other strategy for listening. And reading part A, again, so the reading part A is what you, so reading part A, you are given 15 minutes. What I would suggest you is give 5 minutes to read the whole text and then take your 10 minutes to answer those questions. In this manner, you can actually divide your time and you will have more time to answer those questions. Again, as I told you for the part C, do not read the whole passage, go for the questions directly. Sania Ali Qureshi, should we write only doctor at the end of the letter, or name of the doctor given in the task should be written after your sincerely? So if you are, I do not understand your question quite clearly, but if you are referring to the doctor that you are referring to, you should write the whole name. And for when it comes to yourself, just write Dr. XYZ. And what about writing? How to practice this? I'm getting it very difficult to summarize case notes into short paragraphs. Again, okay. So Alicia, I can understand that. Right. So for the writing, you need to keep yourself very limited to 200 words. Okay. And how to summarize it? Again, what exactly is there? What exactly are you going to do? If you're going to refer a patient with atherosclerosis to a cardiac surgeon, then there is no need to mention that he has cataract or he has some kind of accident 10 years back. You need to just write the relevant history. For example, is he a smoker? Does he has a blood pressure? Or again, does he has any past history of MI? So these are the relevant things. Only need to mention the relevant things. Again, the rule is, first of all, in the first paragraph, you need to mention the purpose and what is the patient name. Second, you need to write is why this patient was admitted in your hospital and what was the treatment given to him. In the third paragraph, you write the relevant history, and in the fourth paragraph, you thank the doctor. Part C of reading is so difficult. Please, Sani Ali Qureshi, again, part C, if you take my tip, part C would be the easiest one. Do not go for the essay. Do not read the essay. Just go for the questions and then go back to the essay or the text or the context. And then then your mind will be very focused. Then you will be know what answer are you looking in that passage. So first question is always from first paragraph. Second question is also always from second paragraph. So go for that. Samiullah is, should we give OET in final year or house job as it is only valid for 2 years, or opt for ALS in the 4 year? Samiullah, I would say just get done with your MBBS first and then decide it. Okay, it's useless to give OET in final year or in when you are in your MBBS study, unless and until you are planning for something else, unless and until you are planning to get a PLAB seat as soon as possible. Okay, then go for OET in the final year. But if that's not your purpose, then it's useless to give OET in your final year. Okay. Assalamu alaikum. How to join the course? Is there any? Aska, we will tell you at the end how to join the course. The admin facilities will provide the link in the WhatsApp group. I'm sure. Inshallah. Samiullah.
Hello, sir.
Yes, please. I can hear you.
So I just cleared my final year, and I'm confused that when should I appear for an OET exam? Like few of my friends, they're going to appear in the June and July, upcoming June and July. And
Okay.
some of my seniors suggested me that I should give it when I'm halfway done with my house job. And some are
Okay.
suggesting that I should appear for it after my house job. So I'm a bit confused in that sense. I do have plans after house job for like lab exam or maybe something else. So a little
Okay.
happened that.
Sure, no problem. Can you please tell me your name?
Dr. Sarbaz.
Okay, Dr. Sarbaz. Dr. Sarbaz, again, I think it was you who tapped this question. Okay, no problem. So, no, it was Samuel. Dr. Sarbaz, the thing is, it depends on your goals. So, for example, in my case, I took my OET when I was doing the house job, when I was in the middle of my house job. Why? Because the seats of lab were going to release and I wanted to book those seats. So, if that's your aim, go for OET as soon as possible, because without the OET exam, you cannot book the PLAB seat. If that's your mission, if that's your purpose, if that's your goal, go for OET as soon as possible, even during the house job or middle of the house job, because you right now, as far as I am aware, there are not any news from GMC when are they going to release the next PLAB seats, but they always give 1 month or like 40 days. They announce that 40 days later they are going to release the PLAB seat. So if that's your mission, go for it. Go for the PLAB, I would say, as soon as possible, maybe in a month or time, maybe in a couple of months time. But if that's not your goal, if you say that I want to focus on my house job, and then after my house job, your goal. If your goal is to book the lab seat as soon as possible, go for it. If not, focus on your house job, learn your skills, polish your skills, and then afterwards go for the OET exam. And please, please do not, I understand it's a human nature to get into the peer pressure and to follow whatever your seniors are doing or your classmates are doing. No, please keep your goals focused. Get Always have a plan, and by that, and what I mean is, make sure, get aware of yourself, and please have a plan, write your goals, and then act accordingly. Otherwise it's very useless to just get into the peer pressure, do something under peer pressure.
Okay, sir. Thank you.
Munazza Khalid. No problem, Dr. Sawad. Munazza Khalid, hello, I'm from Pakistan. Tell me, what are the parts of exam I'm starting thinking to give exam? Munazza, as for every exam, as for every language exam, there are four subparts: reading, writing, listening, and speaking. And you'll be assessed from that. But the difference between OET and IELTS is in OET, you'll be assessed in the context of healthcare. Uh, Sir, I am Itlia from Lahore, Pakistan. By profession, I am a nurse. I am preparing for OET. I have a question. I want to ask you how to be perfect in reading part A. Itlia, I am not sure if I'm pronouncing your name correctly or not, but Itlia, in reading part A, what I will suggest you is keep a stopwatch with yourself, okay? And there are 15, assign yourself 15 minutes and just give yourself 5 minutes to read the passage, the whole passage, and then give yourself 10 minutes to answer those questions. In that way, you will practice yourself in that. If you do keep practice by this manner, and you will have 10 minutes to answer those questions and only 5 minutes to read. And if you keep practicing, then your reading will, your ability to read will get more and more polished, and you will have more time to answer those questions. And I'm sure after 4 to 5 practice sessions like this, you will finish this even before 15 minutes. Zoom user in speaking, can we use the same phrases in both role plays, or is it better to use different one? Can we use the same phrases in both role? You can use the both role same phrases. It, again, as I mentioned, you do not need to use fancy words. You do not need to use very fancy grammar for that. In speaking, what are they? How are they going to assess you? They're going to assess you if you have asked those questions which are given to you on your card or not. That's it. And if you're rushing or not, if you are taking your time listening to the patient or not, that is the criteria. They are not going to judge you whatever the phrases you will use in that. Munazza Khalid, validity of OT. Unfortunately, it's 2 years, but sometimes, if GMC can allow you more, a couple of months more, if you have recently passed your PLAB2, but overall it's 2 years. Zoom user, how much letters are to be written before taking the exam? It depends on you. If you are good with 5 letters, good for you. If you're good with 10 letters, it depends on you. It's a very subjective question. Itlia is reading part C is also very trouble for me. Italy, again, as I told you, for the part C, the only trick is to not read the whole passage first and then go for questions. Go for questions. The good thing for the part C is the questions are in chronological order. Okay, so the first question will always be from the first paragraph. The second question will always be from the second paragraph. So read the question and then go to the passage, and then you will know what you are looking for. Ehsan is asking, sir, can you guide me for Australia? Which one is IELTS or am a final? As Ishan, I do not know about Australia. All I know is you have to take AMC exam, and you can take OET or IELTS. It depends on you. You can take IELTS academic or you can take the OET. Other than that, I'm really sorry. I do not know much about Australia. At start of the listening, at which point they allow us to open the listening part. Okay, so in the listening part you will be given the answer sheet, and as you are hearing you will have to answer the questions simultaneously. Amir is asking, sir, I am practicing part 1 reading listening test daily. Is it enough or should I practice more tests in a day? But my reading score is not improving. Amir, if you are practicing and if your reading score is not improving, then you need feedback. Then you need some expert advice. Then you need, kind of feedback which can tell you where exactly are you lagging, what exactly are you struggling with. So my advice to you too is that please keep practicing more and opt for this course. Here I can help you. I can actually tell you where exactly what is the part that you are struggling with. Okay, thank you. No problem, Italia. Rafia is how to finish 20 questions in 10 minutes. Any suggestion in reading? What 20 question? Are you, Rafia, are you asking about the part A? Please tell me this, and then I'll answer your question. How release after FCPS OET in which ways will be helpful? I mean, in which programs? However, after FCPS, I don't know. If you are going for GMC registration through MRC, yes, MRCP pathway, then OET can be helpful for you. If you are doing your FCPS, then if you opt for the CPSP exchange program, you will have to go for OET. Other than that, if you're trying to register yourself in any country where the English is the primarily language, you will need OET. For example, after FCPS, if you want to work in Ireland and if you want to opt for the IMC registration, you will be asked to give the proof of your OET exam. Okay, if you are asking for part A reading, again, see, this is exactly what I'm telling you. How to finish 10 questions in 10 minutes is that you need to keep your stopwatch with yourself. You need to assign yourself 5 minutes for reading and 10 minutes for answering the questions. In that way, if you keep practicing in this manner, then you'll be able to finish 20 questions in 10 to 15. Tanya Ali Qureshi, sir, you did not understand my question. I'm trying to ask sometimes in task of letter writing. It's writing you are Dr. XYZ and the task, and then the task is given. I am asking, shall we write that name of doctor after you sincerely? I'm trying to ask you in task of writing. It's written. Oh, yes, 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 yes. If the name is written, if it's written that you are Dr. XYZ, then yes, after your sincerely, you are supposed to write that name. Okay. I hope that answers. I'm sorry if I didn't get it in the first time. Amjad Khan is, sir, I need OET for Australia as I already got offer. Kindly help. Last time I got B in writing and C in rest modules. Want your help, Dr. Amjad. So, Dr. Amjad, have you got the Australian registration? Have you got any offer from Australia? What exactly it is? But again, if you got B in writing and C in the rest modules, which means that you are struggling with whole of that. Okay, you are struggling with speaking, you're struggling with listening, and you're struggling with reading as well. So for you, what I would say, if you want my help, I cannot help you in such a short time. For that, I would really suggest you to please come and join this course. In that course, I can help you. I cannot help you in 10 minutes or 15 minutes because I don't know what exactly are you lagging, what exactly are your weaknesses. Okay, I hope that helps. Sir, in listening they will give us headphones or will we listen to a loudspeaker because I heard the audio is very bad. No, Ahmed, you will be given headphones and the quality of audio quality is very good. Thank you, Sania. You're welcome, Sania. Amjad, yes, I want to. Amjad, then okay, if you are opting for the course, then I will suggest please join a WhatsApp, and there the details will be given, how to join, when to join, and when the course will be starting. Okay, Amjad, and I can totally understand your anxiety, and please do not, take me wrong, but honestly, in such short span of time, I cannot help you unless and until I know what exactly is your problem, where are you struggling with. So if you join our course, then of course I will be able to help you personally. Thank you. Okay. I hope so far the questions are answered. Anybody has any other question or query, please let me know.
Sir, I have given exam previously. Then I can't go through in a B grade in all set. Then I my confidence is now shattered. Therefore, difficult to book exam.
Mm-hmm.
In
What exactly is you struggling with the cover? Can you please tell me?
sir, in my listening and reading are weak.
Okay.
I got 300 marks in listening, and in writing 320. Reading was 360 and speaking 340.
Okay, so you are struggling with listening and you are struggling with reading, right?
Writing, sir, listening and writing.
Listening and writing. Okay. And you say your confidence is shattered and you are very, very, now you are doubtful if you should book the exam again or not, right?
Sir, yes, their fee of OET is much greater than double than IELTS.
Yes.
Therefore,
Yes, I understand.
total wastage of money if you can't get a required score.
Exactly. Exactly. So what exactly is your question? What exactly are you asking here? How I'm not
Sir,
understanding what exactly.
in next attempt, how can maintain confidence and how can improve the weakness of these weak areas?
Okay, okay, Khabar, I appreciate your question, and I can totally understand that, when you are giving this much time of yours to a test and this much, and I understand OET is not a cheap exam. It comes with a lot of price. So, Kawa, one thing I would suggest you is, do not go for exam. See, when you're half baked, when you're half cooked, okay? Go for the exam when you are confident in yourself that, now is the time. Now I'm fully aware. Now I'm fully prepared. Now I'll jump into the exam. But again, the question is how you will get that confidence back. How you will, know how you will be in that situation. You will be confident that now I'm very well prepared. First of all, is it depends how much practicing are you doing, and second is, again, you need feedback. Okay, so if you want my help, I would suggest you is please come and join this course, and in this course I will try to help you. I will try to make sure that your weaknesses are, you are aware of your weaknesses, and everything that you struggle with are answered, and we will have practice sessions, and we will keep practicing until you yourself are confident that what, now I'm confident, now I'm very well aware, and now I can jump into the exam. That is why I'm always saying that there was somebody who is asking question that how much time do we need for OET preparation. Again, as I said, it is a very subjective thing. Sometimes people may need 1 month, sometimes people may need a couple of weeks, so it all depends. And in your case, however, please do not be disheartened, do not get be disheartened by this temporary failure. Keep practicing, and if you want my help, please come join this course, and I will try my best to help you, inshallah. And inshallah, you will ace this exam. Do not worry about that. Course can be on Zoom or physical presence. I'm just, the course will be on Zoom, or we will do it on the Google Meet, but it will be a virtual class. It will not be a physical presence class. Are 50 sample writing tasks good for that? Zoom user, if you can do 50 sample writing tasks, it's good. But honestly speaking, after 5 to 6 or around 10 writing tasks, you are very well aware how to attempt the writing task. 50 is very much, it's very lot in number. Munazza Khalid, can you please elaborate the parts, like what to do in listening, what in writing? Munazza, okay, so in the reading part, you will be given three samples. The first sample will be you will have to read a passage, and then you will have to pick some, I would say, fill in the blanks, and sometimes you will have to match the answer in what column was this answer given. In the part two of the reading, you'll be given a short, I would say, paragraph, and then multiple choices answers below that, and then you will have to opt for the perfect or the appropriate one. And in the part C, you will be given a long essay. You have to read that all, and then at the end you will be given some questions, and you'll have to answer that. And same goes for the listening. Listening has three parts as well. You will be listening to some conversation, and you will have to answer that simultaneously. And in speaking, you will be given two cards, and you will have to ask those questions given on those cards. And in the reading, sorry, in the writing, you will be given one task. It can be discharge, it can be referral, and you will have to write that. Dr. Ari, how to start role play cards? If it's in the card, it's mentioned that you have examined the patient, can't elaborate. So, Dr. Ali, in the speaking part, it's very speaking part is the easiest one, I would say. Why? Because before you start the speaking test, the examiner, the invigilator there will try to have a conversation with you just to make you at ease and gain some confidence. You can ask them, honestly, they will answer you. You can ask them that, I have read the task, it's given here, and if it's in the setting, should I introduce myself or should I just start the card? You can ask them, and they will be, and they're very, very helpful people. They're very kind people, and they will tell you that, you know what, just skip this part and start. Sometimes they will ask, you will have to introduce yourself, and then we will take on from there. No problem, Zoom user. However, sir, now elaborate your course of 18. So, however, we will have 16 sessions. Okay, we will have 4 sessions each week. We will have the course will be from Monday to Thursday. So we will have each module in one week. For example, in the first week, we will have reading, writing, listening, and speaking. Again, it goes in the second week. We will repeat that. In the third week, we'll repeat that. In the fourth week, we'll repeat that. But what is the difference? The difference is in one week, we'll be practicing part A. In the second week, we will be practicing part B, and in the third week, we will be practicing part C. The fourth week, we will try to answer your queries, and I will try to answer your queries, and I will be giving the feedback, individual feedback that this guy is struggling here and this guy is struggling there. So this is what the course is about. The course is you will practice with me. You will be I will be there with you, and you can ask me questions directly there. And it will be like two-hour session for each class. Zoom user in exam, do they provide extra sheet if needed? Yes, Zoom user, they will provide you with an extra sheet, no problem. What does the sir about sample test? Does it give the same experience as the actual test? Yes, Murtaza, it can give you the same taste, it can give you the same experience, but honestly speaking, it can give you the experience of the questions, but it cannot give you the experience of that environment. For example, examination setting is always different. You cannot have, for example, if you're attempting a sample test in your home, you will not have the experience, you will not that have pressure of sitting in an examination hall and having the worry to write this exam in that given time. And again, so yes, the experience, if you can, if you're asking that, will it get you prepared? Yes, but the experience, I would say, examination experience is always different. You cannot have the examination experience before the exam. It doesn't matter if you're taking mock or not. What is the way can we find it? Again, you can find the sample test on official OET website. It's there. They have uploaded a number of sample tests there. You can access them. Okay. Any other question, any other query, please ask. No problem, Murtaza. Dr. Ali, in speaking, if it says emergency, then should we ask about patient introduction or directly start with the task? So, Dr. Ali, see, your question answers yourself. So in the emergency setting, you have to be realistic. In emergency setting, you do not actually introduce yourself. If it's in the emergency setting, you so it depends. For example, there are two, I have seen there are two actually scenarios given in the speaking. In one scenario is that in the emergency, the patient has been stabilized and now you are asked to go and check on him. So in that case, I do not think you have to introduce yourself because the patient has been there in the emergency setting and he has been stabilized. So it's given that you have introduced yourself before. But if it's in the emergency setting and then you need to introduce yourself. For example, that my name is Dr. Kashif and I'll be taking care of you. That's it. How to iPhone? I do not know your original name. How to join the course and when it will start. iPhone, I will suggest you to please join our WhatsApp group. The admin will give you the WhatsApp link in the chat. Please join the WhatsApp group and this information will be there. The relevant information will be there. Okay. Okay, Itlia, thank you so much. No problem, Itlia. Amjad Khan, if someone cannot get full score, so can repeat in 6 months, but have to appear in all modules. No, Amjad Khan, unfortunately, you have to take the whole exam again. OET does not give you this option that, take one or only those parts that you have failed. Unfortunately, you have to take the whole exam. You have to pay the whole fee again. Okay, any other question, any other query? Please feel free to ask. Somebody has raised hands. Yes, please, can you unmute yourself, doctor, or can you ask? Hajra, want a recording of this meeting so I can watch another. Hajra, yes, after the meeting is finished, we will share the recorded session in the WhatsApp group and you can watch it. No problem. Zoom user, do they provide mineral water? We can bring it. They will provide you with the mineral water. Don't worry. Or you can actually bring your own water. You just have to remove the wrapper of it. It goes both ways. No problem for that. Hajra is asking WhatsApp. Hajra, I think you have been replied with the WhatsApp group link. Zoom user, at what time usually speaking starts? Zoom user, the speaking is speaking time. The speaking is one of the last module that you will have to attempt, but for every person, the speaking part, the speaking time is different. You will get to know at the day of the exam. They will have a list of every candidate and the time when their speaking will start. So I cannot answer this question right here. Murtaza, delivery modes, OET is available in 3 delivery modes. You can, yes, Murtaza, but in Pakistan, you cannot give OET at home. Okay, OET at home is given in specific countries. You will see the name of those countries. And about computer and paper, yes, both are available in Pakistan. It depends on you. What kind of delivery mode are you comfortable with? Are you comfortable with the paper mode? Go for it. If you're comfortable with the computer mode, go for it. The only edge of taking the computer part with against the paper part is the result of the computer part uh, is released early within, I would say, 7 to 10 working days. It says some people say that the days we select for OET, we should be selecting the last days of the month because it has more easier tests than the starting days. No, that's not true. It's just a myth. Do not, believe these kinds of rumors. What is the difference between update letter and discharge letter? So, doctor, the difference between update letter and discharge letter is the discharge letter is you are discharging the patient from the hospital, okay, and in that you are summarizing why was that patient admitted in your hospital and what is the treatment that you have given to him or her. In the update letter, so you need to understand that it's not that the UK system, Irish healthcare system, or any other healthcare system, they do not work in exactly the manner the healthcare system is working in South Asian countries like Pakistan, India, Bangladesh. In updating, you're actually updating his or her general physician about his current situation. So in those countries, every person is registered with a general physician. Okay, so if they are out of their area and if they are seen by other doctors, So those doctors have to write an update letter to their general physician just to make them aware that this is the current situation of their registered patient. Okay, I hope this answers your question. Amir, what if we finish the speaking card before 5 minutes? Will it affect our grade? Not at all, Amir, not at all. If you are asking all the questions, if you are listening to a patient, and if you are finishing it before 5 minutes, good for you. I actually finished it in 4 minutes, and after that, you just have to keep silent. No problem in that. There just two role play cards, or they have more role play cards? For one person, there are more role play cards, but in general, I do not know how many role cards they have in one exam, but you will be given two role cards. Amjad Khan, I mean, I have to repeat all those, but those already passed modules must pass next time, or can I get the? So Amjad Khan, whenever you are taking the exam again, so if you have flunked one part or two parts, and when you are taking the exam, you are taking it from a new start. You will have to pass all those modules again. Doctor, which pattern we should be following for writing Jashan or benchmark? So, doctor, this is one of the thing that I really get upset with is there is no one, there is nothing like pattern. So there is no defined pattern when it comes to the writing. You can follow any pattern, you can follow anything, as long as you are giving the relevant information and keeping all the useful information in your letter. It's good. You do not have to follow any specific pattern by Jashan or by benchmark. Okay. Khatija, again, it's the same question asked by doctor. Again, I will say the same question. You do not have to follow any specific pattern as long as you're keeping your letter relevant and you're keeping the relevant information inside. Doesn't matter the pattern. Khatija, can we look at the play card only? Yes, you can actually look at your play card because it's really hard to memorize all those questions. Will have to keep looking down at your play card. The key is you have to maintain an eye contact. You can look down and then maintain an eye contact again and again. It's no problem. Listening and reading patterns are little bit changed in E2 practice and in EIRS practice, which should be followed. Doctor, again, you're asking some questions that are really hard for me to answer. Again, any academy or any course that you will offer will have a different pattern. If you ask your colleagues, if you ask your seniors, your juniors, your friends, everybody has a different pattern, everybody has a different set of approaching to things. Okay, so it's really hard for me which one do you want to follow or which one should you follow. You should follow one which you feel more comfortable with and which are giving you the result. Okay. Okay, any other question? There are 28 participants left. Assalamu alaikum, sir. Can you kindly break down the areas respect the assess in listening part A, B, and C? It would be nice if you can explain in easier terms. Thank you. Abdullah, see, the thing is, in listening, they're not going to assess you. So for in listening, they will assess, they will collectively take the whole listening part. They will calculate your marks in total, and then they will decide what are your marks. So in A, B, and C, as it's see, the thing is, as it is very it's self-explanatory. What is the subpart? Listening subpart. So it doesn't matter the A, B, or C. What are they assessing you on? They're assessing you on your listening skill, on your ability to listen and to hear properly, and then to absorb that knowledge, and then you to keep retain that knowledge. So in listening part, your listening is assessed. In part A and B and C, there are different, you can say these are different subtests in which there are different kind of settings in which they will assess your listening skills. For example, in one is there is a conversation, in one there is just a kind of, I would say, commentary. So your listening is being assessed, but in different types of sets, in different types of examples. That's how I would answer your question. And listening as the instruction started, and we are already familiar with them, so we start reading extras like as just, yes, you can, doctor, no problem in that. When I listened to OET official listening test, their audio was good, but in OET online test sample accent and audio was poor. So in real exam is audio. No, in real exam the audio is very clear and the accent is also very clear. I mean, you do not need to worry about that. Okay. And official in one part you are saying OET official listening test and then OET online sample test. So I think it answers your question. In on official website, if the audio is clear, then you do not need to worry about OET online test. OET online test can be uploaded by any third party. Okay. So can you help in PTE examination also if someone wants PTE exam? What kind of examination is this? Amjad Khan, I have never heard of it. Can you please tell me? So, Anuprish, what date should be written in letter writing? The date given in case notes? No, the date given in the case notes. Okay, you should always write the dates which are given in the case notes, Sania. Okay, it computer-based test having all modules. Thank you. Amjad, I'm really sorry. I don't think we can help you in that. I have never heard of this exam before, and we do not have any courses for this exam. Amjad, I'm really sorry. Sir, I want to join your OET course. Itlia, you're most welcome. Please join the WhatsApp group and all the relevant information will be given there. Thank you, Itlia. Any other question, anybody? Any tips for writing? Amir, tips for writing is keep yourself very precise. Okay, keep yourself limited to 200 to 210 max. Okay, 200 to 210 words max, and then keep your information relevant and keep it very simple. You do not need to mention all the past history. You do not need to mention all the treatment given. You do not need to mention the surgery the patient has been gone through. Just keep the relevant information. Just see what is the subject of that letter and keep the relevant information there and keep it very precise. I will join your course. You're most welcome, Amjad. Thank you. Is there any pattern that we have to follow in writing letter paragraphs? Khatija, see, again, there is no hard and fast rule when it comes to the writing, but what I would suggest in the first line or in the first paragraph, you mention the aim of your letter and what exactly are you doing to do now. For example, you can mention that I'm writing this referral letter for the patient A, B, Z, and C who was admitted in our healthcare with this problem. Okay, and then in the second paragraph, you mention why was that patient presented to your hospital, what actually happened to him, and what was the treatment given to him. And in the third paragraph, you mention the relevant past history, past surgical history, medical history, whatever that is. And in the fourth paragraph, you mention why are you referring. You can tell that I am referring now. We do not have enough facilities, or now the patient is getting better, or not getting better. This is the reason we are referring this patient to you, and that's it. That's one of my tips in the writing. Amir, I just explained the tips for writing. What date should be written in the current date? I will thank you. And okay. Any other question? Will you please share this recording in the group? Yes, doctor, the recording will be shared after the session ends. It will be shared with you after some hours. We will have to edit it a little bit and then we will share the recording with you. Dr. Nadia is asking about the fee. Dr. Nadia, can you please join the WhatsApp group and everything about the course, the dates, the fee, everything will be shared there by the admin. Okay, please do join the WhatsApp group. Any other question, guys? Sorry. How to deal with anxiety before exam? This is one question. If you find the answer, please do tell me the answer of this as well. See, the anxiety before the exam or the anxiety before the result, it's natural. Okay, I will not tell you, and I will not say to you that it's you will have to do that and you will have to do that. See, the anxiety, it's natural. Okay, this is how we humans are built. We do take anxiety, we do take some kind of pressure. It's really, really normal. But again, how do you deal with this anxiety before the exam? Before exam, do whatever is in your hands. You can prepare yourself, you can practice a lot, and then you can put your faith in Allah, and that's it. Rest, leave it to your preparation and leave it to your God. That's it. That's how you keep your anxiety away. But again, as I said, it's natural to have anxiety before exam. Doesn't matter how much well prepared you are, you will have those anxiety or panic attacks or a little bit of tension in your head. You will have that. So just try to calm yourself, try to tell yourself that you are well prepared, you have given your time, you have taken your time, you have passed the mock test, you have practiced a lot, and just keep try to calm yourself down. Okay, sorry. So there is no particular pattern we have to follow according to referral. All pattern will be the same para into and M. Khatija, yes, more or less the thing is that. But what is the difference between discharge, referral, or update? The content of the letter. Okay, the content of the letter is different. Otherwise, there is no hard and fast rule. You will have to introduce yourself in the para one, and then aim, and then the relevant information. So there is no particular pattern, honestly. The thing is, you have to keep your letter to the point and keep it to yourself. Doctor, yes, the recording will be shared in the group. Abdullah is asking, so can you please give a demo on how we begin the speaking subclass, beginning with the introduction and building rapport? Okay, Abdullah, in the speaking part, before you start your test, your invigilator will try to have some conversation with you. He or she will ask how you're doing, what do you do. The aim for that conversation is to make you at ease, to give you some confidence, to build that exactly what your invigilator is doing, trying to build rapport with you. So in that in that 1 or 2 minutes, you can ask them, okay, I have read the notes, shall I introduce myself, or what do you say? So that's at 1 to 2 minutes before the speaking is started. They will give you time, they will themselves initiate a conversation with you. And with the question of you, can you give us a demo? So it's very simple. For example, you will be given a card, we can start. It depends at what time your speaking is being held. Most of the time it's afternoon. You can say, good afternoon, my name is Dr. Kashif Azam, one of the doctor working in this emergency department. I can see from my notes that you presented here with some of your problems, and I will be happy to help you today. Can you please tell me what exactly is bothering you? And then you can go on with the second question. That's it. Khatija Aga is saying, thank you. Got it. No problem, Khatija. No problem, Dullah. Anybody has any other question? Please ask. I think everybody has asked their queries. I'll give you guys some more time, 10 minutes more. If you guys have any other questions, please ask. Otherwise, I will end this session now. So I will just, before you guys leave, I will just give you a simple insight of this course. As I mentioned, there will be 16 sessions, and I'll be there with you. These sessions will be live, and in these sessions we will practice together. I'll give you feedback, and we will practice and we'll prepare together. Khatija is asking, now for speaking, if the patient is in emergency, do we have to greet them the same way as the patient is the clinic? Khatija, it depends. Yes, you will have to. Honestly, you will have to, but they will be not giving you a scenario of a real emergency. Okay. For example, they will not be giving you a scenario where the patient is rushing into the emergency department, you will have to perform CPR. It will be more likely the patient presented in the emergency department with some problem, and now he or she is feeling better. And now you are going to now your task is to go talk to the patient and ask them how they are feeling. In that case, yes, you can explain. You can. It's always safe to introduce yourself. Okay, it's always safe. Just tell them, my name is Dr. Kashif Faz, and I saw you before when you presented earlier today in the emergency department. I'm here to ask you about, how you're feeling now. It's always safe to introduce yourself. Jashila, today is a great session and spending a valuable time. No problem, Jashila. Thank you so much for your feedback. Thank you so much, sir, for giving us such a good information. No problem, Nitya. No problem. I'm happy to help. Do you guys have any other question? No. Okay, guys, I hope your queries are answered and everything that you guys needed to know. I hope I answered your questions. But if there is anything else, please do type in the WhatsApp group and I'll try to answer those questions later. And sir, kindly let us know about the stationery that we have to carry. You can carry a couple of pencils with yourself, lead pencils. Otherwise, if you do not want to carry them with yourself, they will provide you with the stationery. Okay. Okay. Okay, guys, I think that's enough. I will end this session. The recording of this session will be provided to you in the WhatsApp group. If there is any other question, please do type in the WhatsApp group. I will try to answer that later tonight. And don't worry, it's just exam, and this exam is not as hard as you think it is. You guys have passed your medical school exam, which were way harder than this exam. So surely you will ace this exam as well. Okay. Take care of yourself, guys, and remember me in your duas as I need them very sincerely. Okay. Okay. You're welcome, Mahro. Thank you so much. Okay. Take care of yourself, guys.